Thank you for the opportunity to speak today. I am Becky Dale, CMA, MA, and I am currently a Medical Assisting Program Director, Chair of Mayor, a Site Surveyor, and the President of NCSMA. This course is COM 101, Introduction to Communications. The assignment instructions were to record a speech on a topic that is either an issue, cause, or problem that you are currently advocating for or would like to in the future. As educator and a healthcare professional, we all share a common goal to prepare medical assistants who are competent, confident, and ready to provide the highest quality of care. Recently, there has been a lot of discussion about offering medical assisting programs through our continuing education departments. While the attention is often to meet the needs and demands for the workforce quickly, it is important to examine what this means for our students, our employers, and ultimately patient care. So let's look at it. First, we must look at accreditation. Accredited programs undergo that rigorous review of agencies such as CAHIP and ABHES. That means everything from curriculum structure to the clinical competencies, along with assessment methods, and not to mention that faculty qualification. All of those must meet what those standards and guidelines are. While our continuing education programs, they offer flexibility and lack this level of that external oversight. Next, we look at certification and career advancement. Graduates of an accredited program are eligible to sit for the CMA AAMA examination. This in our profession is looked at as the gold standard, along with other nationally recognized certifications. Students who complete a non-accredited program, they often discover that they are not eligible for certification, which limits their job opportunities and long-term career growth. Next, we look at clinical experience and patient safety. A defining feature of accredited programs is required supervision of clinical externships. Students gain that hands-on experience in that real medical setting while they are under that trained professional and must demonstrate proficiency in nationally recognized competencies. In contrast, we look at those continuing education programs. They may have inconsistent externship requirements, or they lack that structure and that relationship with those clinical partners. Next, we look at employer and community trust. When employers hire graduates of an accredited program, they know they are bringing in individuals from trained in that core competency. This protects not only healthcare facilities, but also the integrity of the medical assisting profession. Accreditation builds trust between the school, the employer, and patients we ultimately serve. We also look at long-term work development. While continuing education offers that quick, short-term solution, accredited programs create substantial workforce pipelines. We keep that relationship with those partners and our communities of interest. In closing, continuing education serves an important role for short-term courses and that skill refresher, but it cannot replace the rigor, structure, and credibility of those accredited medical assisting programs. Accreditation protects students' futures. It supports employers' expectations. And most importantly, it ensures patients receive care from trained, competent, credentialed professionals. If our mission is to prepare high-quality medical assistants who elevate our profession, then accreditation is not simply valuable, it is essential.